Hello, and welcome to Courageous Doctors, the new show for you and your doctor. On today's show, we'll cover Obamacare updates, other interesting healthcare news, and health and safety tips. Now let's begin. USA Today. Employees are paying more in contributions for their health insurance, an average of almost $2,500 for premium increases, and almost $2,200 more for copays and deductibles. USA Today. Millions of Americans now lack insurance benefits due to part-time employment. They may also not be eligible for Medicaid if they unfortunately live in states that have not expanded Medicaid rolls. That's bad. Wall Street Journal. The Health Republic Insurance of New York, which is the largest nonprofit co-op in America, is going out of business because it ran out of money. And in fact, co-ops in 23 states all across America formed with the exchange money are in shaky times and may be going out of business also. So check with your insurance company if you're an exchange co-op. Kaiser Health News. People insured under COBRAs through a former employer now have to pay for the entire premium. Boy, not good news so far. Let's see if we can get some better news. Associated Press. 390,000 women who are on Planned Parenthood where they get their health care. If it's defunded by Congress, they could be out of health care. Congress is thinking about defunding it due to the selling of fetal body parts after abortions. Wow. Star Ledger. The Blues have formed an alliance with hospitals in New Jersey called Omnia, O-M-N-I-A, but they left out 38 hospitals. Lawsuits and legislation are now pending contesting these exclusions. Star Ledger. St. Michael's Hospital has gone bankrupt, but hospitals are now bidding for it, and let's stay tuned and see who buys it. That's a very prestigious old hospital. We've got to keep it going. Washington Post. United Healthcare may withdraw from exchanges in 2017. Boy, these exchanges are sure having trouble. We've just got to figure out a better way. We're paying, seems like we're losing big insurance companies. We're not having all access to doctors, co-ops going out of business, people paying more for their meds. We've got to do better with these exchanges. All right, Kaiser Health News. Only 85,000 people, again, about the exchanges, only 85,000 people from 11,000 small businesses have joined on the small business exchanges. This is something new called the SHOP, the shop. And that's less than 1% of the small business market. We've got to get the business community involved if we're going to have money going into this exchange system for Obamacare. Modern healthcare. Medicare Part B premiums went up 52%. Wow. Kaiser Health News. Those with chronic illness pay twice the out-of-pocket cost for drugs on exchanges than their friends do that have private employer plans. That doesn't make sense. You're on the exchange. You think the drugs will be cheaper. Something's wrong. Kaiser Health News. Most exchanges, again, cover the cost of cancer drugs, but with higher out-of-pocket payments, even if the drugs are generic. Boy, something's got to be done. In fact, generic drug costs are increased, and they think due in part to a lack of competition with generic drugs. You know, generic drugs have gone up since Medicare prefers generics, and we've had a shortage of the private drugs. It says this lack of competition might be due to the FDA holding up 4,300 new drugs that are still pending. So hopefully the FDA will find a way through that.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists, and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls, for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
Hi, my name is Marla Gruber, holistic health coach, smile expert, founder of the WIN program for children, a yogi trainee, and a mom to 2 teenage children. I'm excited to introduce into Dr. Barry's office my services of increasing your child's positive energy. My goal is to get the body comfortable so it can function at its full potential, enabling them to smile from the inside out daily. I will help both you and your child understand that being healthy is not just an absence of disease, it's having vitality. I believe that life is a journey, not a destination. I will help you enjoy the process of guiding your child to living a better quality of life and being the best that they can be. I look forward to helping you. Thank you for listening, and keep smiling.
Now let's move on to other healthcare updates. New York Times, cucumbers from Mexico have caused salmonella, which is a diarrhea disease, salmonella outbreaks in 24 states. Be careful. See where your cucumbers are coming from. Star Ledger, there was a Costco chicken salad recall a little while ago due to E. coli. And ABC News talked about norovirus outbreaks continuing at the Chipotle restaurants. Boy, that restaurant's still continuing to have problems, but the experts say they're getting it under control, hopefully. New York City Health Department reports a pertussis outbreak, and New Jersey also reports one in Monmouth County. So make sure that your kids have their shots, and even we as adults should update our adult pertussis shots. New York Times, 3 deaths due to plague in the Southwest in the Yosemite National Park area. Now, don't be too alarmed in this. Although plague's a terrorist disease, plague is also endemic in that area, and there's always some plague that surfaces. But be careful if you're camping out in that area. Just talk to the officials and make sure you're in a safe area. Associated Press reports increase of rabbit fever. Okay, I guess if you own rabbits, be careful. Los Angeles Times, this year's flu has the correct strains. Okay, finally some good news. Although a caveat there, recently we had a report of a new strain of flu. It's not going to be widespread. It's very specific. People that have pig farms apparently in Jersey had picked up this flu from their pigs, but they seem to recover from illness, and it's not widespread. But New Jersey officials are keeping an eye on this. But basically, the flu shot's a good one. It's working, and we're covering the strains. So that's certainly good news. Huffington Post, the country's better prepared for Ebola crisis, although many surveys from nurses have refuted that. But basically, our officials tell us we're better prepared if it hits us. USA Today, the CDC says the Pentagon, remember, had mislabeled shipments of plague, and they're storing and shipping, and they had sent out plague by mistake or had stored it by mistake. But that has nothing to do with the plague I mentioned that's endemic in southwest United States. But this was something the Pentagon was fixing, just like back in May. Remember, the Army had sent out some anthrax samples that were improperly labeled. So officials have handled this. Congress has worked with them, and they've handled this, but I'm just reporting it. New York Times, this is good news. Nobel Prize was awarded in chemistry for discovering ways that our cells repair DNA. Nice. And 2 Americans, Paul Modric at Duke and Aziz Sankar, nearby to Duke at University of North Carolina. So that's certainly that's some uplifting news. Let's continue. The Wall Street Journal, a test called Oncotype Diagnostics. It was able to separate out those patients with breast cancer needing chemo from those that don't. And that's always good news, because you don't want to do chemo if you don't have to. The American Cancer Society has revised its mammogram guidelines now to begin at 45 instead of 40. And unless there's a family history or other high risk for breast cancer, and your doctor would know that. And then once you reach 55, it'll be screened every other year. So remember, the mammograms have changed. Insurance will now pay at 45 if they go by these revised guidelines instead of 40. So check with your doctor on that. New York Times, the Agency for Cancer Research, says that cancer can be associated with processed meats. And Los Angeles Times says that They looked at a study that there's an association with processed meats and stomach cancer and red meats with prostate and pancreatic cancer. And USA Today said that each 50 grams of processed meat, if it's eaten daily, will increase the chance of colorectal cancer by 18%. I don't know how many of us are going to stop eating the processed meats or red meats, but it's something to probably keep in mind. I'm sure most of America will continue eating it. USA Today, the new guidelines, they come out every 5 years. The Health and Human Service and, the USDA, United States Dietary Agency, are actually saying that lean meats and eggs are now okay. They're more concerned still with lowering the sodium and the sugar intake, and they said the sugar intake should not be more than 12 teaspoons a day. And I guess don't do that all at once. Star Ledger says that peanut allergies can be prevented if infants are exposed to peanuts early. That came from a February article in the New England Journal of Medicine earlier this year. Time reports that, this is interesting, artificial skin is being developed for amputees hooked up to a sensing kind of circuit. It's interesting. New York Times, the Cleveland Clinic, this is fascinating, performed the first womb transplant in America. It had previously been performed in Sweden. Fascinating. So we're getting some good news. Health Day said that this isn't so good, that heart attacks can go undiagnosed. They looked at a lot of people in a JAMA study, Journal of American Medical Association, and the study said that 8% of those studied between the ages of 45 and 84 had scars, in other words, heart attacks, and only 1/4 of them knew it. All right, let's move on now, lastly, to health and safety tips. Star Ledger says that the government released new food safety rules for manufacturers in the handling and process, and that's always good. Remember that the Center for Disease Control has told us that 1 out of 6 of us will be food poisoned every time we eat out. So we really need these safety rules in place. And this is an interesting fact. You may not know this, that most of our seafood is a foreign import. So that has to also come under the same safety guidance. 70% of our seafood comes in overseas, 20% of our veggies, and 50% of our fruit. I did not know that. Back in 2011, also, if you remember, the New England Journal reported how the food safety net system created better coordination to tell us where these poisonings are occurring. All right, let's see. Star Ledger. New York City restaurants now have that little salt shaker symbol on any foods that have over the total daily requirement of 2.3 grams of salt in it. So if you're in New York, look for the shaker on the menu. New England Journal of Medicine had a study showing the effects of certain dietary supplements for energy or weight loss. And this is very scary, caused chest pain and had increased incidence of going to the emergency room. So if you're on, these dietary supplements for weight loss or to get more energy, be aware you can have chest pain. CNN reports that children, this is scary, get drunk on alcohol from hand sanitizers. Boy, the alcohol content, 45 to 95%. I did not know that. And it only takes a few squirts to be poisoned. Ouch. The Infectious Disease Journal in Children, actually a newsletter, said that longer lunch breaks lead to healthier food choices in school. That's always good. The New England Journal of Medicine, and this is bad, reported in Kaiser Health News that 10% of our elderly people are abused. Boy, if you know anybody, we have to look out for each other. If you see or hear anything, please speak up. That's just terrible. That's disgusting. All right, and finally, this is interesting. Pediatrics in Review, another journal. Dr. Sarah Green reviewed foreign body ingestions, and she said that 70% occurred in children less than 5 years old, and usually due to coins, magnets, small toys, buttons, bones, jewelry, and retained food. Now, 10 to 20% of these needed removal, and usually signs of needing removal is like there's drooling or blood, frothy sputum, gagging and pain, painful swallowing. 50% of these scarilies, 50% had no signs at all. Now, the problem with the magnets is if the magnets are in different places and they attract and force gut together, they can actually take out circulation. So, interesting art. Well, that's it for our news show today. As always, thank you for joining us. We would love to hear from you. Facebook, email, send in your comments and we'll share them with you next time. And as always, we'll see you then and have a good evening.